kwantu emu won sense pepere emu yare nemu amani uno ti afia man kwata maklo e NyinsenNeAwoɔ pre enu se on kasanwie no na wanya wo na no anduro aboso me kwantu emu won sense pepere emu yare nemu amani uno ti afia man kwata maklo NyinsenNeAwoɔ pre enu se on kasanwie no na wanya wo na no anduro enti kwasie da nwomre bia radio no na Adom NyinsenNeAwoɔ pre apono wojino radio no na Adom NyinsenNeAwoɔ pre 106.3 radio no na Adom NyinsenNeAwoɔ pre ti afia mankwata makru ewo Adom FM 106.3 na obeyin shira
Meda se papa pasa wa fidie ne da Adom 106.3 FM. NyinsenNeAwoɔ ebre na asui meda DJ Wana ene ne bana se papa pa enwuma wo mo de agye ababa. Frisabre kosisa no woche ebebo no. Ene ye ba bedi enkomo ahye NyinsenNeAwoɔ mu na last week na kidney awareness month and a week enti no ehu behia se wonyinsen mu nso no bi bebusa o edamede to wo Facebook ene Instagram nom ne ade se yesese we kidney patient nyinsen mu kra no e was woji advice from doctors so betimi anyinsen na ya na complications no ebi etimi ha oba no ene akra na ye wo no enti kidney no oba onyemo no problem na kwan be enti kidney in pregnancy kidney disease in pregnancy ho enkomo ena nwumre ye ba bedie meda endpoint homeopathic clinic ase papa yare bi e ha wo china yakopon ya adom a na wotwe foforo mu ne yasie no ha bia no fakọ endpoint homeopathic clinic na on show ma ho enyo de ma no infections no ha dwene yenko ne yenko hye ya wodie no mu bibia ye kama yensiesie kwan mu emfama abofra eba no sanso ne mema no so prostate na wose ye bo ho eban so prostate no bo ho eban ti ne yekọ endpoint a wose sa screening no oye ede ama oye da endpoint homeopathic clinic ase Gini Foods wose mafie ye de eyampa Gini nuane ni nyina mafie ye da mpa wo mo rice isi anu so de nti wanya ojolof bi na de Gini Food rice na eye no hu say different mutu so eye nti Gini nuane ne de eye ni mayonnaise no so sawa ye salad bi no ati bi so mesenwa ede tin fish no so anu so na ede pa Gini Foods ye da mo ase papa wokọ edwa akese nkuma mu nyina obenya Gini nuane no bi Rojan Herbal Clinic nso ye da mo ase ye papa nyarwa hodo a ha wo se stomach ulcer na wo so no unya acid stomach mixture ebeboa wo aseda natural mixture so umoja opeso wo check so umoja na flow ye anansi bia ncheche wo no aseda heba mixture no so typhoid na malaria unya binumu a wona wo kro no aseda tonic nso wanumu ato anase umoja so atie unya enumu a ebeboa nyuma koya da romanti ene yatena se ede NyinsenNeAwoɔ dwumadie ebra maba Facebook David Techmensen nice program wa badodon Georgina Akosua so chia ye kwasi athan so chia ye enafe David Jackson Fry and so also Afghanistan wash if wow yeda se papa panti obi amfre se fia amankwata makula tena NyinsenNeAwoɔ wone ne doctor eba bedi enkomo afa kidney disease in pregnancy enti mon share na wo like na wo comment de edi hu komo wo adwenche wo question bia fa ho a mesro fabra na yanyia no emfa maw na nwumrei menya me doctor Penny ewa ha from Kolebu Teaching Hospital Dr. Winfred ba ewo ahase obaba boye na yene no edi enkomo enti be so you asum ye pa na kidney no wa mo ho ban a be ha dwene ne nsuo sen wano mu nsuo akoto asen watumi anomo kidney ne yeso do hia ne nsuo na wodidi ye exercise wo kidney no oye save na wonidi na wonum nsuo na wodwunso bia wodwunso aye yellow eti se anka ani a problem te me sro moment so ntumi kidney no se be ye adwuma na eye no ubenya hoden no waye ne saa nti doctor physician consultant wo Kolebu Teaching Hospital. Doctor Nwumrei ye moajo do ya no aben microphone ama me doc twi no so no mu enhyeda nya yi sa but otime ka de na times ni bi nso wo hono mu a bia na ya nya ne twi no a mo fa nche ye mekirikire mu yi se be yo bia ebeti ase nti doc mesa mu akwa babiem yada se papa pasa Nwumrei so ma ho kwan na wo ne eba bedi enkomo kidney disease in pregnancy. Kidney na nkasa de yentie yenya sankyeremu ne wi an yehunu disease kura kidney no enya opemfo etimi enya bie
mdasi na michia etiefo nyina mpacho kidney no wanya ne din wo twi ni mu
adano kwa
all right it say senior ye kan last time kidney no small organs we ewo
yemfi
mienu senior me kan last time no
last time senior obi ani hu eno ye TV so tu kan umbeka say bia ya beka wahada
okay nti most people were kidney no mienu
okay
only a few people no more back but senior ye kan no obia betimia live on one anything na yetimi ye na ye friend no kidney transplant say ye be yi obi there back na ye the amount enti a very important organ ye niama bebre wo body no
okay
eno na ti say filter unu minsu a but ebe filter na afa nia body ni be hia na afa nia kano na aba ti say junso enti eno na produce juice no yi waste na efe no waste products it is ebia odidi o ana onu medro body no ebe breaking it down efe no metabolism
okay
na the good part aka na nia waste products no na abesen efa Johnson no mo
okay
can say etimi produce hormones bi efe no erythropoietin eno so timi ma stimulate bone marrow no na produce red blood cells and then na ma moja some produce hormone back renin and also regulate blood pressure
okay
and na regulate your friend saying calcium bone health ni inti eye nyama bebre
I see
eye nyama bebre yeah
and then I say kidney no eni woni padua mu a am say
unyefu na ya ka say ti say moja untimi junso na bia insuo na onum no ni nya wo body mu a ebeko other parts of the body ti eni na betia ma wo na hunu ana we ni me hunu unsa ni wo yefu aye kese because insuo entimi mba ana junso no entimi mba na waste products no wo body no mu a na enema wo yare no ye ti say so ufi na hunam ye basa because of waste products na etimi ko wakoma ho etimi ko wo bre etimi ko na cause different problems
and the kidney no or very important we ni padua mu pa any kwan say ye didi agro into kidney disease no ebi ne de
enti ye won ye friend no say ye were two broad categories friend acute kidney injury and a chronic kidney disease acute no niama bebre timi cause ye be bo ebide no yetimi reverse functional back to normal
okay
say see a chronic na che say damage na e cause kidney I cost for more than 3 months. Not just a check for more than 3 months. Now say you see a chronic and not just say damage now I yet to some extent untimi reversing back to normal.
Okay.
Intianuna say a chronic start from stage 1 to 5. 5 non your friend end stage renal disease. Then no edru honoma. Hona esa we dialysis and now we kidney transplant. Na acute anything be abema say loss of volume. Ti say ebia unya diarrhea ana diarrhea ni ukotole bebre uye matu ana ufi bebre na one replace insulin send ya mika ye no kidney no be shut it down temporarily just uko mi so bebre ana uko hospital ya ma o drip ya replace fluid na just na it can reverse back to normal but ye beba specific to one but this one we are talking general inti ebia obi so bleedy bebre na ya replace volume no na just ya manu moja na fluids the kidneys can shut down temporarily if acute but who replace it can go back to and now being a severe infection being pneumonia now when you severe infection or better acute kidney injury by your treating it can go back to normal. Maybe you see some drobina no intent to say can painkillers ni herbal ni way no no intent you can reverse it. You want nyama bebre etimi cause no. Say chronic ni there. The main causes worldwide and in Ghana are diabetes ni that's SHA any BP hypertension those are the most important causes, the common causes. But your nyama baby infections in the kidney inflammation glomerulonephritis we mu dem nim ni
twi ampa as an over for terms
other systemic diseases cause connective tissue disease endro drugs. Those who abuse a lot of painkillers, to say NSAIDs, NyinsenNeAwoɔ no brufen. Some of them are like brufen, diclofenac, naproxen. Those celebrants who abusing it for a long time, affecting your kidney. And no more debut herbal medicines, and also to me say your kidney. And we have been seeing some of them. And now you want obstructive cause obstructive. Chen ya mika no kidney no produce urine and produce SFA tube we friend ureter. Na ba wo bladder. Baby a Johnson ja na afa wo be ma mo anaso wo your ba. Nti anything be a timi blocky sa flow no and no so timi ma wo kidney disease. Nti remember no mo prostate here kese no sometimes it may block flow of urine but I don't know who in tema you can reverse it back to normal but say a chair na Johnson ejina hona amba etimi say wo kidney no and now stones kidney stones say both sides and now any tumors anything in the bladder betimi cause
And for NyinsenNeAwoɔ na utie Adom 106.3 FM Dr. Winfred Ba and you AD enkomo kidney diseases in pregnancy ehun komo and one my general overview kidney no ehun enkomo ntimistro umienyi asumni entie ni ye painkillers no bebre wonumri bebra yesi yen kidney no tie mo ho ban titru ema no ye menstrual pain e kire yen saa no a ye kwa ne akoto painkiller bi ni anom ti dog kire saa de ni bebre ne enye My member Facebook Derek Aite ewa oshoye wa committee 20 lashibi. Good evening Sister Fia Major Somedas Victoria Brokra HIM from Asaman Kese Beyonce 1 Beyonce yada se Gladys 9 tete and so shayen watinu ngwa ose yenkoswana yenye adwumaden yada se Kumi Annani and so ewo KSC ehia kaso ho yada se Desmond Agifik and so Kolebu and wo shaye David Techimensen set nanije program yi ho na Amsterdam Afghanistan ni so account there Georgina Akusian so Sarah yada se mon share like a comment if you send a topic na I was so bia enyi na sum ntie me mema no so ya me hira mo mana sometimes ya no mada ba mutie busibisa questions na mamani eje ho ti afei ne ebuawura mu ti sa afei no abeka ye ho a onye late de obeya ma me pa ne so obe share wa comment na afei wa like nti eno ano no dog me samo akwa babiem nti say kidney diseases in pregnancy ho komo ne yedi and we try no mfoni kidney ni nyina ho ade a kire okay nti say ye ba apemfo emu yet me record open for a be onya kidney problem e be a true Nyinsen mu ene ye record bibisa Ghana
yes it sometimes go be say inti awo open for musu timi nya kidney
problem
inti ye wo some different types of kidney disease in pregnancy.
Okay.
More. Maybe our kidney disease dada. Now I say. Aha. Or also, there are issues that can happen in pregnancy.
Okay.
And more kidney disease. But nyinsen and some of the conditions around nyinsen to me man kidney disease. Let me break it down like this. In pregnant women, we can have what we call acute kidney injury. Reversible. For most of the kidney disease in pregnant women is acute and it's reversible. A few of them may be chronic or can move on to chronic. Into yanka acute, then you back chronic. Acute kidney injury. There were 2 peaks in pregnancy. What happens in the first half of pregnancy? So it's a pregnancy. Let's take maybe a total of 40 weeks. See before the first 20 weeks and then the second 20 weeks. Into the first half of pregnancy, there was some specific diseases I call kidney disease or acute kidney injury in pregnancy. One, septic abortion.
Okay.
Into ebimu temi koye abortion. Na abortion no ebi akoye na weni biaka. Na ebi asende omuye no manye ni na infection akom. Now you can be very sick.
Oh, okay.
Temperature. It can one of the complications is acute kidney injury. So it's one of the commonest causes in the first half of pregnancy. Septic abortion. To koya abortion na bia wan koye wo hospital. Na bia wan ko quack bi ho. Na odinyama wo wase. Infection or introducing. And we see quite a lot of young ladies who come like that. And we have to do dialysis for some of them. Yes, and then they recover. Uba in tema, we can manage it and uba recover. The septic abortion. Now abortion and yet infection. Sometimes somebody bleedy baby. Bleedy. So it's a bleeding. Kidney is very sensitive to change in volume. So bleedy baby na replaces your kidneys will shut down. Okay. Bleeding, so septic abortion, apart from the sepsis, abortion akasan, a drobi, na or fear na or bleeding hospital. Oh yes, sir. Some of them they collapse before they even bring them. Oba uchekini HB hemoglobin na be 3 and 4. You have to hurry up and then transfuse them blood. Some of them by number kidneys not shut it down. So we have to give them blood. Some of them we have to do dialysis for them and then they get better.
Okay.
The antepartum hemorrhage so or nyinsen now so one because of one or two reasons or bleeding. Those ones too can cause it. Okay. And the other less common one, like having severe infection in pregnancy. Maybe when your urinary tract infection, but it's been very severe. Any type of infection that is severe enough, everything may affect the kidney. So these are some of the things.
Okay.
Rarely they can have some of those obstructive. Sometimes pregnancy can press on your ureters because it's huge in the womb. It may press on them. Those are not very common, but if they are seen early, we can reverse them.
Okay.
In the second half of pregnancy, you will specific conditions that cause kidney disease, acute kidney injury. Those are what we call one big one is the hypertensive disorders in pregnancy. If you know, nyama ubipi ne koso. Inti you hypertension in pregnancy. You specifically preeclampsia. Preeclampsia, eclampsia, any HELP syndrome. HELP syndrome. We'll try and then break it down. Preeclampsia, no. Say obia only BP. Only say no so BP amba ebia, but from 20 weeks upwards, no, nani BP akosu. That is for gestational hypertension. But say you Johnson protein. Yeah, we do so test na protein womu. Service protein. So we call June so test urinary. Oh, you check protein, glucose, nitrite. This protein. Usually, there's protein means something might be happening from the kidneys. And yeah, protein in pregnancy in every kidney, but most of them are from there. It is our protein about baby. Now you see when you're pre-eclampsia.
Okay.
Now eclampsia, not just when you're pre-eclampsia, and when you're convulsion account. HELP syndrome, no, acronym. I don't think we need to go, but it's also part of the whole thing. It when it affects kidneys, no. Now some of them come down with very severe kidney disease, but like I said, most of them are acute. We are able to manage them and reverse it back to normal. Then your friend thrombotic microangiopathies. I don't want to scare. Confuse us with big terms. Very BTTP, HUS. They can also happen in pregnancy, and they are immune mediated things. I don't know how to explain them, but they are also conditions. The second half of pregnancy, mainly it is the hypertensive disorders in pregnancy, and even after delivery. And then of course you can also have your hemorrhage, bleeding, and all of that. Then after delivery, so you can have what we call postpartum hemorrhage. Maybe placenta na be aka mo hu ye na be bleed and maybe when you tear baby na u bleed baby say yan so no early na yeah, moja anabibia o kidneys no betimi a shut it down.
No cray. Arofo Mr. Mutie ni ye de momientie ni yo na say efri na ni your problem be teach your bapen for wutie me no. Na yes yetumi arashe ne akọ hospital. Phyllis Hackman e wa ha ho se nyame enhira team no yeda sese won so wabaso ekwia Oscar said, good evening. I love this program so much. Very educative. God bless you. Oshayen wo gomwa ojobi. Yada say, Papa Sofia Mensa. Vivian. Good evening. Gladys Makawadi no. Nyamisha mo Papa mon share. We are like in a comment or questions. Be as ye kwe dimi ya no na and also bisa ho ensem. Eti dog. We no a dear ne be course and I said then a course. Ebema bi oba wonyem menye sure say because who can say obi o ho na oni kidney problem but it be a true pregnancy
most of them and then make about pregnancy specific conditions septic abortion pre-eclampsia eclampsia
Inti no sa no okay no work inti no sa no ya reverse ya emabiem
inti ya reverse ya kidneys no will come back to normal. But next pregnancy, etimi samba. Once you've had it before, etimi samba. And that is why anybody who has suffered any of this, they have to see a physician and a kidney doctor, even before the next pregnancy. Because there are some tests, BSA monitor. We should be able to tell you that, okay, baby Adri, you can get pregnant again. So we have a special clinic in Kolibu where we follow up all those. We call it the obstetric medicine clinic. It's a new clinic. But anywhere, you need to get a doctor too because it can happen again. And it's also a risk for future chronic kidney disease. And I think I talked about the acute. Those who have kidney disease already, maybe kidney disease. Now we're NyinsenNeAwoɔ. What is the impact of the pregnancy on the kidney disease? It depends on the stage of the kidney disease. How advanced it is. For those who have more advanced kidney disease, once you get pregnancy, it can worsen your kidney function. During the pregnancy, you may need to even start dialysis during the pregnancy. Yeah. So we can also dialyze pregnant women. Dialysis my pregnant women. But if the outcomes are not as people who are not on dialysis, you may have increased risk of preterm deliveries or stillbirth. Say, but for those who are even able to deliver, it is possible that they may not come off dialysis. They may have to be continue the dialysis. Those who are early, it may worsen their kidney function, but some of them do not have to be dialysis dependent.
Okay.
But what you say? Okay. If you have kidney disease and you want to get pregnant, you have to talk to your doctor because there are certain stages where it will worsen your kidney function and you have to be dialysis dependent. Those are the things. Now we also said that people who are on dialysis already, if you want to get pregnant, you need to have a very serious discussion because one, fertility in people with chronic kidney is lower than the general population. Not just say who kidney disease your ability to get pregnant is lower. Your chances of getting pregnant is lower than somebody who does not have. And then once you get pregnant, we need to give you special attention. Until kidney disease why pregnant, it has to be at a tertiary hospital where we have different specialists. You have obstetricians, gynecologists. They have special interest in what we call high risk pregnancy. Then we need physicians, kidney specialists. We need clinical psychologists. We need dietitians. It's a teamwork.
Na eno sa na se doctor wo de wo kidney no ho ade na wo ye wo be advice sa there were complications.
Some of them we advise anybody who gets chronic kidney disease, we have counseling on pregnancy, fertility and childbearing. We tell them all of that. If you're on dialysis, we tell you. See, some of them if you have to put them on contraceptives. Because of course a young lady anything can happen. So we usually advise them on contraceptives. For those who want to get pregnant, we tell them all the issues that can happen, even the risk of having hypertension in pregnancy if you don't already have, and abortions and the things. Those who want to do, depending on the stage of the case, we can support you. But it has to be close monitoring. So there are some of them we have managed. We have to see you almost every week. You'll be in hospital almost every week because we need to follow you closely. Sometimes we have to admit you for some time, observe some of the things. It's very demanding.
We have some here in Ghana.
Oh yes,
pregnant woman.
Oh yeah, we have in Kolebu. Most of them are referred to Kolebu because that's where the expertise is. So we manage quite a number of them. Some of them will have good outcomes. But yeah, so some of them are preterm. Until they will have to go to NICU, intensive care unit in Inyama.
Wow. NyinsenNeAwoɔ and I would say Adom 106.3 FM. Oh, question be na what the aba. But who so be a question aba. Maybe a doctor na what ya no. Nana ma papa be when late to cry, Mr. Waha, we late to cry no, and nay, yen social media executives to all my ideas say, one call manim, enti yen audios, who do I or topics now on AdomOnline.com as such a podcast. Okohono mwana wa hwehwe NyinsenNeAwoɔ ene die se omo de beto ho ne ya na last week no ne other programs ni nyina no eda ho enti se why late kwa no antie beginning no awoni problem ko podcast Adom online.com na search for NyinsenNeAwoɔ ne topic kidney disease in pregnancy okohono mwana wa nyabre no atie the doctor aka ni nyina nti wonye late kura TB na actually wunya time so anu akọ Joy Samponsa e wo Millennium City Estate no hwe ye fi ye da se e na fe Rito Hinewa no Benewa and so e hwe ye live ye da se Kumi Anani ebusa se what is comedian way what's the sign of kidney stone. I say Kumi ne de no but no maybe dog what's the difference between kidney disease and kidney stones?
Oh, stone. Say kidney disease. We are talking about any disease that may affect your kidney.
Okay.
Kidney stones, no. Yeah, it's under kidney disease. when you have stones, it's like stones. Like I said, it can be in the kidneys, can be in the ureters or anywhere.
Okay, so what we say a sign. Better one who say.
Usually they will cause pain. Kidney stone. Yes, you can say stones no what kidney man. You feel pain in your flanks. Baby, you see kidney na one.
Okay.
You can feel pain. Sometimes the pain can go into your groin or other thing, but usually no, it is pain.
Then also you on a chronic or acute.
Oh, that be kidney stone, kidney stone.
Transplant.
No. Kidney stone, no. Unless say a blocky flow of urine, usually it doesn't cause derangement in your kidney function. Usually it doesn't.
Okay, see, no. Francisca Santiago Dunkwa on a fin or shaying for yada. Sinti Kumia and any me assure say answer a question. No, Ama David Tachman say keep it up. I really like this show. Yada say Asimeku salt pond. How can we prevent this kidney disease? Because it's killing the youth nowadays. We need more education about this kidney disease. Last week, there's some sharing war Adom TV in Kwahia. You can watch some parents. You know, you're the about pregnancy mo. Nti ehun komo eno no ba be sure say dog abone to fa kire nti wo call your podcast horumo a obetimi enya bin so ati nti dog waka say obetimi awo but ebi na akra nkra be ye preterm nti say oba e condition we kidney problem no onye mu a enu be no no menu a pemfo no na no onom ana wasade kidney nu no so aka ho ana.
Okay, into a drone. So that's a good question. I mean, sir, ebia nipa no kidney disease that na when you say. So when you say enya edrobia na otimi fa. Into once when you say your best sister and drone be.
Okay.
Na ya maunia friendly.
Okay.
To the pregnancy, because don't forget that when you are pregnant, there are two lives involved. Anything we do, we have to think about the two. Some of the medicines you may be taking when you are not pregnant, you can't take them when you are pregnant. It will have to change them.
Okay. Lavinia obeying a nice topic yada say papa and a fay Angela Mensa sharing live or hachu and a fay piaga good job you are doing yada say piaga yada say papa na why be yada must say o share like a commenting so yeni beje hu wo kwashi bia so na fay wo de aba na yetumi aboawo enti say dog nyame boa na otime wo fa no ho fa ne ba aside preterm conditions and no awo ho dada na akra so in a way no kidney nya problem.
Oh, it's not likely, sir, because ni mami wa kidney disease or it's not unless it's a genetic thing, but otherwise no, we don't expect the baby to have kidney disease. It is a
nyambo no wo wi because no onyum nti enya niema bia na ye man ye enya no bia no no ye so from there no obeba back.
Into afternoon, so you'll be breastfeeding. During breastfeeding, so it is only after breastfeeding that you can take that. But we have other medicines we can give you. It may be safe for the baby.
Okay. Priscilla Boache Chiaye or showing live or Paris, France. God bless you and your team for the good works. Yada say Papa Victoria Brokwa, please the type of one type here. Victoria for questioning in our brother. Yen share the type of no the no ama inti fabra na Dr. Wahoba boy pa kwesi kumsen say good evening Efia please what causes stomach dear causes stomach you are alive at a Shoman estate. Okay, Pakwesi or question no I mean yes, stomach ulcer, I think so. And say stomach ulcer. And then some can discuss stomach ulcer. Until next time now your D and also home come on. Amalenda, my question please. If you have kidney stones, can you get pregnant with no problem?
Yes, you can. You can. Usually, like I say, kidney stones, it depends on the extent, but usually it may not affect your kidney function. Until you may be fine, just that you may be having pain.
Yeah.
On and off.
Pain, power.
Yeah.
like menstrual pain type ni bia
so we'll give you some painkillers.
No unya sign symptoms bia be kire se bia wo kidney no stones ana
kidney stone there is pain. It's pain into usually, but sometimes no, it depends on the size of the stone.
Okay.
Say a kitwa, it can pass through your urine.
Okay.
Not but some sizes not even just say
Oh, okay, it's me.
Oh yes.
But untimi nya kidney stone ma lead to kidney disease and kidney failure.
It is possible. It is possible, but it is not common. Like I said, unless it's blocking the flow of urine and we don't remove it early. Otherwise, no, most of the time, no, we are able to. Or unless the risk factor na cause stone, no, they say uric acid was so, and now calcium was so. Now you manage no, and no, that risk factor can affect the kidney itself.
Okay. What are the risk factors? Ya bemuna me urine acid.
Uric acid.
Uric. Yeah.
Oh, yeah, one of the friend of metabolites, sometimes yet me lab test I check it. Meaning so uric acid.
Pregnancy test it won't be.
Oh, that when you're pregnancy. I say people are taking us away from the pregnancy
no,
topic.
Taking away from there, no dear, no correct. Okay, but some risk factors and also a binary or kidney disease in pregnancy. No?
Yes, into what we call advanced age in pregnancy. Into just said nipa no when you asana only said they say be 40 years and above. What happens is that your risk of getting either hypertension in pregnancy is high, and not diabetes in pregnancy, and that can itself bring the kidney problem. Then, or more, if you have hypertension, those who have hypertension before they get pregnant, let's just say during the pregnancy, if you are not able to control it well, and also preeclampsia superimpose on the chronic hypertension, then also it puts you at risk of getting or maybe if you have what we call congenital problem with the kidney, maybe polycystic kidney, you get pregnant, it also puts you at risk. Those who have recurrent infections in pregnancy. So those are some of the risk factors.
Okay, Desmond Ajifik. Please, can kidney disease cause a lot of sweating? Possible. If you be sweaty, I just say.
Not really.
We all too If I shake kidney cry this morning. Yeah, that's say Andrews Amanya. So congratulations, keep it up. Watching you live from so many. Yeah, that's say. Okay, Pakwesikum Sena Babiem say please. I mean stomach pains in pregnancy.
But what's the question? What causes stomach pain?
Pains in pregnancy.
Oh, that's a big topic. Abdominal pain in pregnancy. There are so many things that can cause it.
Okay.
Send your American urinary tract infection. But you have pain. The pregnancy itself can sometimes the stretch and all that you can feel some pain.
Okay.
Gastritis and stomach ulcer. You can have pain in your, but there are more serious causes of pain in pregnancy. Abdominal pain. So unya pain. There may be more serious thing. But what I find abruption.
Okay.
Placenta.
Abruption.
To say placenta. Na why every maybe I want it can make you bleed and into NyinsenNeAwoɔ. Na you don't take it as one of those simple. No.
Okay. Yes, more happen for
unya preeclampsia and ubetimi anya pain or top half of your tummy, no? Baby liver no one. In fact, if you are pregnant, you have pain in your tummy, you don't take it lightly.
Mr. Mo, minua man, minua mema, mumienti ene conversation yo. Makatro say, when you start to cry no, o call podcast dromonline.com ayo ho. And there audio no better ho na fe so nya kwan etie bi. Asema ku salt pon second drinking of too much energy drink give you kidney problem.
Ooh, energy drink per se, it depends on what is in it. It depends on what is in it. I would say drinking energy drink will give you kidney disease, but I mean these days people put a lot of things in.
So for energy drink.
We just have to be cautious and careful.
Okay. Asima ku salt pon second drinking of too much energy drink. No okay. Tai anyenugu. So please, what causes sweats on your spinal cord?
Hey, sweat on your spinal cord, bam. Okay, sweat on your spinal cord. Oh, only on your spinal cord.
I know not idea, bo.
Hey. Okay, wait, did you say you na share.
Although it's Victoria T-Pa Junction, Ashaman, Lebanon, and also Eshe Free. That's Papa Kuja Sempa Furniture Works. Good evening to your listeners from Kuja Sempa Furniture Works. Adom Kumase. That's Papa said Munina Mudu Shimon, a woman, Komono, Chuchina, a yet day. What question Banner Doctor Swenya Daji, no, Edia Maya. NyinsenNeAwoɔ by an endpoint homeopathic clinic. I say, Nem Komoi, or Chinakopoya, Domna, the Pebichin, I Shadanko Hospital or endpoint. Na yonko hwehwe ni paduane mu infections so no me ade na doc canon infections ye treat na se babiem se wo hwehwe nyinsen kira kwan a eno so ya na eta ha adwene kakra nti ye hwene ye treat infections ahodo ni nyina ma no a mutie me no mema no so sa prostate no ye mo ho eban wo Dr. Duboatin ho obetimi ahwe friend 0244867068 0244867068 now when a doctor Kasa Sanso and Ginny Foods, you'd almost say, Papa, Womuni and Nina, your market, who do mu beer, Ginny, you don't be or so per rice, or Ginny Foods, one more rice in be a year mayonnaise, no so a year 10 fish in a year, one more milk, and also a year china breakfast, I'll be your winner, Ginny Milker, with the gumwa, and ma Adriano, a year de come up, Papa, into Ginny Foods, but beer, you to be or ho. Rojan Herbal Clinic and so Aseda Herbal Products ho se bia opese wo keep it fit wo ye odene nom ne ade wo nya bia wo na akro no Aseda Herbal Meshan so ye typhoid ne malaria enu Aseda Natural Meshan so se moja broso na hawo moja ntimi flow ye ntide bia wo se ananse achew wo nya Aseda Natural Mesha enuma wo na akro no Adom Aseda stomach mix and so stomach ulcer adro and aseda bitters no so opese oba won sabuo no ya kono ye fe moja flow fine na ho etowo ye mo atimo aseda bitters aseda tonic nso obi a wanumu atoa na moja so awie de wo hia pa eno no nyumakoya daroma ene yetimidi NyinsenNeAwoɔ bra wo hwe live wa Adom 106.3 Facebook or comment no there me the so de bebantem na doctor yi ano na utie yen so Adom 106.3 FM ko Instagram ko Facebook nso afia amanko atamaklo ma share link no ho wo ko shimbi afato ho na fe yenyi ano emfa ma sha no so say ye ne Dr. Winfred Ba and e di nkomo last week na any birthday no kwa man cancer inti dog. Happy birthday, belated. Happy birthday.
Thank you very much, Madam Wasipa.
Let's come different Mukuransa. Fetch me. Wow, birthday with you in year. Into baby, I'll call you now. To baby, I'll call you now. Actually, nice. What the alcohol back?
No problem.
Yeah, that's Andrew Samanya. Our hair does say, and women in Makai.
Oh, yeah, me in-law.
Oh, yo. Oh, yeah, that's it. Yeah, that's a pint. And one me listener for fro. Michelle dog. Yeah, that's a papa pint. One cost one share and then qua waba. They be on share. Isaac Athan so a share from here, Spain, Madrid. A horn was share a free. Please greet my brother, Kwesi Buafo, also in UK, London. And my and your what's that? Yeah, that's it. Dog yan to so enche be be phone lines na mti yemi mpo anesa ma me phone lines na wasa ye koye nim na ya hwe complications wo kidney disease in pregnancy 0302216562 0302216561 Yankom ayedi wo adwenkyere wo question bi afabra doctor wa ha why crowd betie Joyce Amponsa good work done sister Fia and the doctor yedase papa tido yen complications
before you back complications no now there are some subtle things I or during antenatal
okay
it can prompt us say there may be some kidney disease there or now coming. That is why we call antenatal. You check it with Jones every time. There will be a high of proteins and you can say we are paying for na protein or Jones no more. We don't take it lightly.
Sir, hold on, Kakrana me for first caller. Or me mwajo do NyinsenNeAwoɔ so. E pa so me mwajo.
We wa fa.
Mo nyamisha be me na mintie o.
Me say we said banu bi uyima. Na omunai ni nyina tatai. Debe na kotu sale.
O se oba ye de a.
Omunyima na omunai ni nyina tatai.
Yo dog be ya no the amount me that's papa enti also betimi afrede aba dog pacho mamintie wo de na wo kana yemra
it is so protein in the urine no
okay menyo foforo facha me dog facha me pa odo me wajo de NyinsenNeAwoɔ so
ubani ubawo fa ho afa oba
yo mamintie we
the same beside doctor said what are the types of kidney failure and how it depends on also taking now present every kidney failure. Not me we say so for any listener say happy birthday in deleted.
Hey, mate. Mo nyamisha me da se papa panti Victoria no asaman Beyonce ana asaman kese yeda se papa don pacho maminti okakra nti we Victoria de no ye at what age and I obetimi anya kidney failure anom ne ade and types of kidney diseases na me se hono na vek nyama nti ne de eno no foforo so ti don pacho de chocho questions ni nyama ye first call no so de nti a ma
sen mi kan sa protein no say okay
mami yen fefa course
me da say
odo me wajo de NyinsenNeAwoɔ so
Oba
me da se mami minti o
Pacho NyinsenNeAwoɔ omo ye no test all right by omo ehu protein biawo NyinsenNeAwoɔ Tinha 7 months na me dey too kede me for hospital no me say placenta abruption inti later no na me bleed eno eche me bleed inti doctor ma me koye test no ana hu say me kidney problem but I'm not try some mommy antibiotic and so yes so na insulin ko me the doctor say insulin day
na wawa na
me ba try
bibia ye kama abofra ne ye kama
me ba try there me nya abofra
oh kafra pa we o first child na
me ba try
kafra nyame beye enti no na ye say still problem no eda so wo ho
me ba try
problem ne ye dia
so kidney infection
wo de ne ye kidney infection sa na mo ka kire
me ba try
awo hefa
but when we go for Eastern Region.
It's all General Hospital.
Me patron, me call Regional Hospital.
Regional. Okay. So, everybody wanna go as some about Kolebun so me ahwe.
Me patron.
Because why you go for na say or why yen sanse some unko be from here. So what I say. Mo nyamishrao. Nti ye be hwe dem ye da say. Aha. Enti no for so ahoma no so. Okay, obi anya made ne dog yen no kakra mfa mo.
Inti some protein say you have to see your doctor. There may be things we need to follow you up. Now your doctor now who patient. Now protein one, please refer the person to a specialist. Okay,
mama announce phone lines ni bi 0302216562 0302216562 and 0302216561. Now yon koma ye di kidney diseases in pregnancy also the actual wadu no odi aba na fe doctor wa haya no doctor pacho na miti
inti na obi bisa about leg swelling say now your leg swelling in pregnancy no, it could be normal, It is a normal thing. There are a lot of changes for her. A lot of hormones are released.
Okay. Don't fetch me off from Swaba. Or don't me want you to bany send ya was so. Medas, Papa means you.
Well, good evening.
It also.
The fact that you so it's for the program how you your power to the now you also said what stuff now one now oh but that's it.
Hey, what's a man said last one no cry. Fetch me pa of from so also. Or don't me want you to bany send ya was so. Phone lines no hard drink kakra but besa ba shine tie dia woni problem kra don pacho ma menti we na ye moving ko ada ahede
Intellectually no etimi normal but so na it is bothering you just see a doctor be some test be not on my share. Why? And age of kidney disease, I think anybody can get kidney disease. Age be you don't need to get to a certain age before you get kidney disease. And obviously types of kidney, I think you can say can be acute or chronic. And offer free Koforidua. Sometimes when it's severe, you lose your baby.
Okay.
But Nyamika say it's good to see a doctor after. And a baby is a good place. Regional hospital. Bomodiana catch a person physician specialist.
Okay.
Then if they have to refer you, they will refer you. But me money check because we need to work on it fast.
That's what I need be me no no for Francois Humano so. Or don't me want you to bany send ya was so. It has some patch mean you.
Yeah, Mr. Samuel.
You brass on me mean you.
And this so another trend me to kidney stones, no, mean I decided doctor actually no. Stones, no. Hello.
Patch meet you.
Me say tell them what you tomorrow the partner so in America say you get doctor the na me Emma the metro paribu. Emma you for yet me could stones no so good painful and for so intimate we uric acid also send the doctor come never buy associates and I'm sweaty and I do I'm sweaty and you could not say a broken urinary and not asking to me to almost for ye stones no na doctor need be then they were breaking my that will kind of this good I had the parent to get better kidney no. One of them was a pain to be a rib side, no, here in the hospital, not my checking because they very kidney stones.
Yamisha papa so so ashe odi de nyame asema okra nso so aniti da sinyamisha ti emfa last caller kra na dog nyamre mai kakra odo me mwajo do banyi sani awoso. Okay, obi anyama de ne de asi ha o. Okay, ti dog bacho ma inti o kakra.
Inti senior kai no yesi. You are talking about complications.
Okay, and before I back no, I'm learning that the question about so what food can we eat if you have kidney stones?
Okay, inti kidney stones are kidney stones no yawo different causing kidney stones. I think we might have to as organizing one of the days now and talking about kidney stones because today you are talking about pregnancy and kidney. But you can have what we call uric acid stones, calcium stones. There were different types of the stones in the composition.
Okay.
Those things are the ones that are doing. We will find time and talk about this.
Joshua also said, Doc, please, can a high consumption of meat destroy your kidneys?
High
consumption of meat.
Hey, not really. But of course, eating healthy diet is important.
Okay. Ti no. And them say me Facebook for questions na santi dog mintie the complications no de ne kan.
All right. Inti unya kidney disease in pregnancy or any of the acute kidney disease in pregnancy. One, your risk of getting kidney disease in the next pregnancy or in future is also high.
Okay.
That is why anybody who gets any of those complications, they have to be followed up. Some of our hospitals, Yeah, sure. Yeah, discharge your more. Nobody follows them up. Anybody, obia when your kidney disease in pregnancy, has to be followed up by a nephrologist or at least by a physician specialist.
Okay.
At least once a year is okay for us.
Okay.
Because AKI, acute kidney injury, is a risk for chronic kidney disease. So that's one of the things. For some people, it can affect their fertility even in the coming years.
Okay.
If it's not managed very well. Those are some of the things. And for some people, they can move on to get chronic kidney disease. A few.
Okay. I know you want to know. No, be nipa. Then I'll be from stones a bit me akọ.
And yes, stones. So I think people are trying to bring this stone in. We are not talking about stones.
Okay.
We are talking about the kidney disease in pregnancy. And to say I'm managing here, it can move on to become chronic kidney disease.
Okay. And you may pregnant women or more 80 dear na you be catch or more. Say be a regular antenatal checkups and as I said to me, I'm your huru temna yesiano.
Okay. Me da see. Enti ehun hia pass unyima. As a pregnancy there we all your born pie say you go through your antenatal smoothly. Or could deliver smoothly now only back makofie. And that is what we all want. Timi pamucho so who say when you send pe ko doctor. Especially say who any underlying condition. So what sickle cell disease now you have to go. Diabetes, hypertension. Make sure that you see your doctor right from the beginning.
Okay.
Then they will start doing some things, some tests, following you up. Very important. Now, BP, monitoring your blood pressure and pregnancy is very important. Machine you can be doing it. So who say a course na wako doctor. Aha.
Nana Quia if chia or send a kid sister echo yes surgery because the doctor said she had flues in her kidneys. I want to
she
know
had what?
Flues. Fluids.
Fluid.
Yes. When they say something or the S account fluids. FLUID.
Oh, they say it has fluid. Okay. And there may be
just a dorsum.
Maybe in her friend hydronephrosis.
In her kidneys, in her kidneys. Yes. I want to know if it will affect her childbearing. Thank you.
Yes, it is a war issue, and I'm hoping that it is what we call hydronephrosis. Say, Tenamika say, BB blocky, the urine are producing, not a kidney, into ensure a egina kidney, a friend hydronephrosis. And no. We have to remove it. Okay. So yan free honoma etimi sewu kidney.
Okay. Okay. Nti if audience no Anthony Alote say please how can drinking more beer prevent you from getting kidney stones?
Prevent you pa. Stones. Oh no, that will rather increase your risk of getting stones.
Samuel Intiamwa after removing kidney stones can it come back again? Stones. May say
and the kidney stones fire program. Oh yes, so it can come back again.
Okay.
Yes.
Okay. Tidoga me say yen komo twetwe no ya de besi ha nwumre. Enti your final message to business new viewers.
Madam was enti senya ye kan ye no. Painful so omutiminya kidney disease. But senya me can largely most of them no is reversible. Then the most important is to go to hospital early. Obeko na ya manage you. And abortion so like I am saying, the first half of pregnancy, abortion causes kidney disease, especially unsafe abortion. And the young ladies, no, missy coke, almost glass bottles.
Hey,
no more. I don't know how. Well, inti mi pamucho, yenshe naija. So who say who bleed deeper now I call. Wako hospital.
Sir. Eti yane Dr. Winfred ba enkomo twetwe anwumre wo kidney disease in pregnancy no yane no enkomo twetwe no yade ebesi ha anwumre beso enkomo a yede ne nyarewa hodo bi a eha wo no yenko endpoint ho ochena ene na wotwe no munyina akosi memenda endpoint ye adwuma yede na se ono so boye chidom se yemfa dwumadi ati se ye no emro ti yare bia so opese wo test wo kidney wo test wo liver ni nyina no endpoint ye nti friend was 0244867068 0244867068 now the endpoint akasa na fe nkoma ye die nso timi frɛ doctor was 0505786993 0505786993 na nkoma ye die wo pe questions bia nso a wone doctor edi enkomo na bibia tumi akoso ayie Gini Foods eno a wokɔ market bia mu anuane ni nyina wo benya bi won rice milk tin fish mayonnaise bibia Gini kama anunso no ede Rojan Herbal Clinic nso ye do mase papa bidi de afia amankwa tamaklo Dr. Shine Aqua ono ene produce show na Jamestown Jeko nso adaroma nti ode ento mo live wo Facebook a adaroma nso do adwenkyere no bai nyamishira obia se bibi intimate mi anyu de na amfa ma fache da se ne nkwane ahoden wo hɔ a ebeto so